Hey everybody, hope all is well. I just want to take a little bit to share with you an experience I had a couple of months ago regarding an episode of sciatica that I had to deal with. I want to share my experience with you and a little bit about what I learned from it in the hopes that this will help you if you're suffering from sciatica or know somebody that is. In general, sciatica is a condition of leg pain, sometimes numbness and tingling down the leg that is thought to come from a problem in your low back. A couple months ago, I started having some pain into my back and low butt area, which eventually progressed down the entire back of my leg, all the way down to my foot. Started having some numbness in my lower leg and down into my foot. And also got to the point where I had weakness in my calf. So I couldn't go up and down on my toes on my left leg because of the sciatica and the influence or the effect that it was having on the nerve. I couldn't sit for very long. I couldn't walk for very long. Every time I walked and I put my left foot forward, I'd feel a pulling down the entire back of my left leg. This went on for 3 to 4 weeks without much improvement, despite the fact that I was trying to do all the exercises and stretches that a therapist should know how to do, and it wasn't helping. I did continue staying active. I exercised, but obviously had to cut back on some of the things that I was doing. I wasn't able to do any running. Wasn't able to do any jumping because I couldn't push off my left foot very well. I had a difficult time sleeping, had a difficult time sitting. Pretty concerned about it. But the good thing is that I knew what it was. I know the research behind sciatica. I know that if you wait it out and stay active, it's going to get better. I knew that if I were to have an MRI, it would probably show a disc problem that probably was pushing on a nerve in my low back that was giving me the pain down the leg. Okay, but I also know from the research that those issues many times resolve themselves. So I continued staying active. I did my stretches. I gave it time, and after about 4 to 5 weeks, it eventually started to go away. And now I have no pain. I can sit. I can walk, I can run, I'm doing all my lifting exercises, I'm riding my bike, the strength has returned to my lower leg. I can do heel raises and everything without any problems. So, I'm happy about that, okay? But this whole experience, what it really got me thinking about is, what would I feel if I didn't know what I knew about this condition? If I was just a regular patient or person in the general public who all of a sudden started experiencing this. And what I'm going to share or say is that, you know what, I can imagine that if I didn't know what was going on, how scary this would be, how worried I would be about it, wouldn't know what to do because even me knowing what to do or what I thought would help didn't really help. And so, I thought about if I was a regular person that didn't have the knowledge that I have, what would have happened to me, right? I probably would have went and had a consultation with my physician, okay? Given that it wasn't getting better and that I had weakness in my calf muscle, I probably would have had an MRI, right? And the MRI likely would have shown what I said before, a disc problem or something on the nerve, okay? Once you enter into the medical system with something like this, lots of things can happen. Hopefully, maybe I would have been referred for physical therapy. More than likely, given the condition and the pain I was having and some of the other findings, I probably would have been referred to either receive injections or referred for a surgical consult because weakness in a muscle is one of the indications that surgeons use for performing a low back surgery. So I'm very lucky and very happy that I know what I know because I didn't go down that route. I know the evidence, long-term evidence for injections, and I know the long-term outcomes of low back surgeries or lumbar fusions and all that stuff. And I know that conservative care, meaning exercise, staying active, therapy, is just as effective for that stuff long term. Um, so I guess, it gave me the outlook, or it gave me the realization that this stuff can be scary. And having gone through it, I have a better appreciation of what a patient might be feeling. And what I want to communicate to you all is that despite the amount of pain that you're having, despite the fact that it hurts sometimes doing everything and there doesn't seem to be anything that you can do to help, that, with the right knowledge and guidance and with doing some of the exercises and staying active, this stuff can get better on its own. Okay, now again, I knew what to do. I knew that I shouldn't worry about it. I knew that it eventually would get better. Many of you out there may know somebody that's having an episode of sciatica, or are experiencing it yourself. And what I'll tell you is, get some help. Find somebody that knows about it. Don't necessarily jump right into the imaging. Try to get some treatment from somebody that's specialized in taking care of this type of condition. And know that with the right approach, many times sciatica, no matter how bad it feels at the time, can get better, and that you can get back to doing everything that you normally would be doing. I'm proof of that. I just went through it. It wasn't fun, but I'm recovered. And I'm taking the steps now to get strong again and get active and get on and live the life that I want to live. And so what I'll just tell you is, if you're struggling with this, anything like that, and just don't seem to be getting over it, just go ahead and, give me a call. And we can chat on the phone. We can meet in person and see if there's something that I can do to help you get through this. But you don't have to live with it. You don't have to resort to a surgery. And you shouldn't, without doing everything possible to try to help yourself. So, as always, feel free to contact me if you have any questions or want to talk further about this subject. Thanks.